Today marks 18 months since the first diagnosed case of COVID-19 in Texas, and as we head into another holiday weekend, national health leaders are urging those who are not vaccinated to stay home and those who are vaccinated to still mask up. I want to bring in our medical expert, Dr. David Winter. I don't know, Dr. Winter, how realistic it is to ask people to stay home at this point if they're not vaccinated. I don't know that they'll adhere to that. But anyway, we are more than a year and a half into this pandemic. COVID cases are peaking. Can we attribute this solely to the Delta variant?
Indeed we can, Sonia. It's more than 90+% in America right now. We know it's more contagious, more likely to spread from person to person. We were seeing a little tapering earlier in the week of cases, but now they're going back up again. Today was the highest number of cases since last January. So this thing is on the run. I hate to hear this about the school kids, but it's spreading among them and everyone else right now.
Can we break this down? Because I think I've heard a lot of people go, well, then why does it matter if I'm not vaccinated? Vaccinated people are still getting this, breakthrough cases. I listened in on the ACIP meeting earlier this week and heard data that indicates that these vaccines are still highly effective, even months after. So even with Delta, why are there breakthroughs?
Yeah, it's a very important question. The vaccines are doing exactly what they were designed to do, prevent serious illness. There's a big difference in COVID-19 in an unvaccinated patient and in a vaccinated patient. Our hospitals now are bursting at the seams, running out of room for the COVID cases. As of this morning, actually, 92% of all COVID cases in our hospitals are unvaccinated. Look at the folks on respirators, breathing machines, 95% are unvaccinated. Most folks that are vaccinated and get COVID, I've seen a bunch of them. Mild illness, 2 or 3 days, stuffy nose, sore throat, then they recover. Big difference between vaccinated and unvaccinated when you get this virus in your body.
Dr. Winter, I'm wondering, I'm looking at these numbers, and I know you're talking about the adults here. I have asked a lot of the children's hospitals in this area. I haven't gotten a response. Have you heard anything about any common thread between what kids are being hospitalized? I mean, do they have underlying health conditions? Are they, the older kids versus younger kids? This is information that, I haven't heard about or read about anywhere.
Yeah, it's an important question. In fact, most of the kids who are hospitalized are healthy kids. Now, a small percentage of kids get sick enough to go in a hospital. Most kids have no symptoms or minimal symptoms, but as this virus spreads, more and more kids get it. That small percentage gets larger and larger and is filling up our hospital beds. So kids, fortunately, usually do well. But I think we need to protect our kids also because a small minority of those folks get very, very sick.
A recent study from Israel reported that people who've been sick with COVID are better protected than those who've been vaccinated. So is this so-called natural immunity better protection than immunity that you would get from a vaccine?
Yeah, Sonia, I read that study. It's very interesting. It actually goes against previous studies. One criticism is a retrospective study, looking backwards. When you look back, you don't always get the number of cases in the different categories exactly correct. The other thing to point out again is that they're measuring total cases, but a COVID case in an unvaccinated person is totally different in a vaccinated person. So that doesn't really change my feeling or my thinking all about the importance of getting a vaccine right now.
Yeah, I'm with you. Not all studies are created equal. And Dr. Winter, finally, flu season around the corner, and worldwide studies on influenza are showing fewer cases than in past years. But we usually look at Australia to determine or predict how we might fare here. Australia, as we know, is locked down, so of course they're going to have fewer cases. So how important are flu shots this year, and how will we determine or predict what we might see in terms of flu in this country?
Yeah, Sonia, last year, you remember we saw very few cases of influenza, also very few common colds and other respiratory illnesses. Masking, distancing, washing our hands makes a difference. Will it be back again this year? Hopefully not. It depends on how well we do those 3 things. It may not be a big thing, but I'm very convinced that flu vaccines are important. Look back at 2018, the biggest surge we've had in a long time with influenza. 80,000 Americans died. Half of those folks were young, healthy people. So yeah, I think you should get a flu vaccine. If you don't, you're rolling the dice with influenza also.
Yeah, we certainly don't need that. All right, Dr. David Winter, thank you so much. Good to see you. Appreciate it.